Hello, this video is going to teach you how to make your change out with your pump. What you're going to need is your Mio Advance infusion set, your reservoir, and we're going to take everything out, your insulin pump, and some alcohol wipes. Once you have all of this stuff, we will now move on to getting things changed out. You're going to remove all the old stuff off your body. So come to your body and remove the old sticker. You're going to twist out the insulin and throw everything out because we're going to put everything brand new on your body. Please try to do this a couple hours before you go to bed. Do not change it out and then go to bed. Because we want to make sure everything's working. So what you're going to do is we're going to take your syringe and you're going to pull down to the number that was given to you at training. So for today's purposes, we're just going to pull down to like 1.5. And you're going to follow the top black line. You're going to grab your insulin, put it on the table, take the blue adapter, and then you're going to snap it down onto the vial of insulin. You're going to flip it over and push all that air in and then let go. And what you will notice is it will start to fill up on its own with what air we've pushed in. So that's going to take a minute or two. If you want, you can grab the bottom of the plunger and start helping assist it move along just a tad bit quicker. Once you're at your number, just make sure that we get all of the air bubbles out. You can use your nail, you can use a pen, pencil. Just want to make sure that all the air bubbles are gone. Push those air bubbles in a little bit and then pull back down. Once we are back to where we need it to be, you can hold it like a little bit of a level. Do you see all these air bubbles? Those are champagne bubbles. We want to get those back in. But the little tiny bubbles, we're okay with champagne. Get those in. Okay. So champagne bubbles like this are fine. You just don't want the big fat air bubbles. So then we're going to put it onto the counter and you're going to pull off the two pieces, twist and pull the blue off. Now we're going to grab the cap, push the cap down and twist, okay? Once we've twisted it, I did a bad job twisting it. So we're going to push and twist. And it doesn't want to go. We're going to have to redo this. So we twist it and push it in. And now we're going to unscrew the bottom. Just like that. Don't pull on it. You're just going to unscrew it like a light bulb. Now we're going to come to the pump. We're going to press the center button on the pump. And we're going to go over to the icon, the reservoir and set. Press the center button. You're going to pick new reservoir and set. And this is going to walk you through telling you to remove the old stuff off your body. Go ahead and press next center button. And then it says remove the old insulin. So you're going to pull the old insulin out and then press the center button to rewind the piston. So the piston will rewind. Once it's completed, it goes to the next steps. It says fill the reservoir. We have filled it. Connect the tubing. We connected it. And now we're going to press the center button on next. And now we're going to take this reservoir. We're going to put it in and twist it until it locks. Okay, now we're going to press the center button again for next. Now we're in the loading phase. You're going to have to hold the center button down. And as we're holding it down, the piston is moving up. And when we get a check mark here, we will stop. Perfect. There's our check mark. We're gonna hit next, okay? Now we gotta fill the tubing. So at the end of your tubing, you are going to see a plastic piece. We have to remove this. So you're going to pinch the sides here and remove the plastic piece off. And now we're gonna hold the center button down until we see insulin coming out of the end. And you'll see it in those drips, okay? Usually that's between 6.5 and 7.5 for the 23-inch. And it's usually 11 to 12.5 for the 43-inch. Once we are over, we're gonna press the right arrow to highlight next, press the center button, and now we're at the fill cannula. So now we need to grab this piece here, and we're gonna put this piece anywhere on the body, okay? So we can use the stomach area. You just wanna be 2 to 3 fingers away from the belly button. Make sure if we are using the belly that we are staying away from any type of scar tissue or stretch marks. You can do the sides of your belly, the upper part of your butt, the thigh, and the back of the arm. What you're going to do is get yourself ready. So we're gonna pinch and pull the safety off of the applicator. You're gonna remove the bottom part. So now this is sticky. And then these arrows are telling you where this connection is going to happen. So we're going to lay it down onto your belly. Let's pretend that this is my belly. We're going to put it down and then nice and gentle on the skin, press the center button, and now it is on my belly. We're going to then take this piece and snap it in. And then we're gonna come back to the pump and we're gonna press fill. Your fill amount should be 0.600 and then hit fill now. And now, once you see this, you've done it correctly. Thank you.